Okay, now we will continue with the skin. So the learning outcomes for the integumentary system will be explain the structure and function of the integument as well as the characteristics of each of the layers. Describe the structures associated with the skin, glands, hair, and nails. All right, some fun facts about skin. Well, it's waterproof. And what makes it waterproof is the stratified squamous keratinized epithelium. It's stretchable. You have elastic and collagen fibers. As you get older, you lose some of that elastic and collagen, so you start to get wrinkles. Here's washable. Hopefully you take a shower. It can invisibly repair small cuts, rips, and burns. Guaranteed to last a lifetime with reasonable care. Weighs on average between 9 and 11 pounds, but it depends on how much you weigh, right? So a better accurate description would be it's about 7 to 15% of your total body weight. So if you weigh 100 pounds, it could be anywhere from 7 pounds to 15 pounds of your body weight. Measures between 1.5 and 4 millimeters thick. And thick skin, which is found in the palms and the soles, you don't have hair follicles or oil glands. You can get sweaty palms, but you can't get oily palms. Okay, so now what's the function of skin? Well, it protects deeper tissues from mechanical damage, chemical damage, bacterial damage, thermal damage, ultraviolet radiation, and desiccation. Do you know what desiccation means? Desiccation, you're like, yeah, from drying out. Desiccate means from drying out. If you look at the layers of the skin, you have the epidermis, you have the dermis, and then you have the hypodermis. If you have a tattoo, and we'll talk about tattoos a little bit later, just so you get a perspective of this, what layer do you think tattoos are in? Well, if they were in the epidermis, since you get a new epidermis every 28 days, it would actually fade and go away. So they're definitely not in the epidermis. Permanent tattoos are actually found in the dermis. Now henna, if you know what henna is, it's an Indian temporary tattoo that they do during weddings mostly. They're in the epidermis. That's why it washes off in about 2-3 weeks. Okay, but if you look at this is the hair shaft. You have some sweat glands here. And then remember in class I was telling you you have over 1 million muscles, but those are the little erector pili muscles that are attached to each hair follicle that gives you goosebumps. Okay. And then you have sebaceous oil glands that are attached to the hair. So if you have an oily scalp, you can get oil that is secreted along here. Okay, and then you have these receptors down here that will measure pain, pressure, temperature, and we'll go in a little bit more detail about these Pacinian and Meissner's receptors in the next few slides. Now you ever look at this and when you go in the swimming pool and you get wrinkly fingers and then your mom or dad will say, okay, you're turning into a broom, time to get out. Well, what's interesting about that is this is just a natural reaction that occurs in the body, and what it does is it helps to grip better. So wrinkly fingers and toes improve our grip on wet or submerged objects, working on to channel away the water like tread on a tire. It's believed to be involuntary reaction by the body's autonomic nervous system. So here's a funny thing. They tried to do this on someone that had a brain injury, and they would submerge their hand in the water, and guess what? It didn't become wrinkled. So if there's damage to the brain, then your fingers don't become wrinkled. Interesting, right? So, but there is no real detriment to the skin or you for getting wrinkly skin. So next time you're in the pool and your kids are playing around, it's been 30 minutes, an hour, and they get wrinkly, they look like a little raisin, it's fine. Don't worry about it. It's good to take a break once in a while, but they don't need to take a break just because of the wrinkly skin. Okay. Here's the epithelial. So you have the apical surface, which is the free surface. It faces the body surface, the body cavity, the lumen, which is the opening of an internal organ or tubular duct. So you definitely want to know what the apical surface is here. And then you have lateral surfaces here that faces the adjacent cells, contains tight junctions, desmosomes, and gap junctions, which are right here. Okay. And then you have the basal or basal, however you want to say it, surface, which is the deepest layer of the cell. And it usually has 2 layers here. Okay, so that's the basement membrane. You have the basal lamina and the reticular lamina right here. And then after that, you have the connective tissue. So you can see it's epithelial tissue, and then connective tissue is deep to that. So if I ask you, connective tissue is deep to epithelial, that would be true. Epithelial tissue is superficial to connective tissue, that would also be true. So getting your medical terminology usage. You have the basal lamina, which is extracellular matrix, and then you have reticular lamina, which is made up of type 3 collagen right here. Now, skin itself is keratinized stratified squamous epithelium, and it has 1, 2, 3, 4, 5 layers. The way I remember this is college ladies grab some beer. You're like, what? Okay, college lads grab some beer. But you have to make these mnemonics in anatomy to remember this stuff. The one thing that I will tell you is that the stratum lucidum is not found in all the layers. The stratum lucidum is only found in the palms and the soles of your feet. Okay, so that's a good question that you might want to know. What's the exception, right? But here are the layers: stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. So I can ask you, hey, name the layers from superficial to deep or deep to superficial. And the mnemonic that I use is college ladies grab some beer. Okay, but if I say name the layers that are found on your arm, then you would not include the stratum lucidum, because the stratum lucidum is only found, remember, in the palms and soles of your feet. So make sure you always read the question carefully. There's 4 types of cells. You have keratinocytes, you have melanocytes, you have Langerhans cells, and you have Merkel cells. And I'll tell you what each one does in just a little bit. Okay, so you have keratinocytes that produce keratin, a fibrous protein providing external protection. They form in the deepest layer of the epidermis. They migrate to the surface and they're sloughed off. Melanocytes synthesize pigment called melanin. Okay, so this is what gives you your skin color. Found in the deepest layer of the epidermis. Protect keratinocytes nucleus from UV radiation. Now remember, every single human has the same number of melanocytes. It's just the amount of melanin that we produce that produces the different skin color. Okay, so if you have less melanin, you're going to be lighter skinned. If you have more melanin, you're going to be darker skinned. So remember, skin color should not determine a patient's, or I say a patient, but a person's characteristic. Okay, because basically it is just an adaptation to protect the human from the environment. Meaning, if my ancestors lived in a place where it was 115, 120 degrees, well, I'm going to need more melanin to protect my skin, right? If I didn't have that melanin to protect me, I could get UV radiation, I could get cancer, and the human race of that region could get wiped out. So we adapt. Humans are very good at adapting to the environment that we're in. So skin color, again, is just an adaptation that we have to the environment that we live in. It should not be used to determine a patient's or a person's personality, characteristics, etc., etc. Unfortunately, our society makes a lot of judgment calls based on the color of their skin, which is very, very I don't want to get into the social aspects of that, but you know what I'm trying to say. Okay, dendritic cells are aka also Langerhans cells. I just like saying Langerhans. I think it's German, named after the scientist that found them, of course. form in the bone marrow, migrate to the epidermis, meaning they migrate up. Basically, they're macrophages that help to activate the immune system, but they're easily damaged by UV radiation. So if you're exposed to the sun too much and you kill off the cells that are there to protect you, well, there's no protection, right? So that's why sunscreen is very important. Tactile cells, also known as Merkel cells, are at the epidermal and dermal layer, and they have sensory receptors for touch. So you can see what these look like: keratin, keratinocyte, melanocytes, Langerhans, and Merkel cells. So make sure you know that these cells are found in the epidermis and what they do. Now again, keratinocytes, 90% of the epidermal cells, composed of protein keratin, produces laminar granules, so you can see those, releasing water repellent sealant, so it will seal that. It sheds, and it's also responsible for wound healing. Melanocytes are 8% of the epidermis. Okay, so they're right here. Produce the pigment called melanin. Their cuboidal cell body with arm-like processes between neighboring keratinocytes. Transfer melanin granules to keratinocytes. Melanin is yellow to red or brown-black pigment contributing to skin color and absorbs UV light. Like I mentioned, if you live in an environment where there's a lot of sun and a lot of UV, that you're going to need more melanin to protect you. Okay? Protect nuclear DNA from UV damage. So melanin is very important to protect your DNA. Okay? So here are the Langerhans. They're found in the bone marrow. Here's the blood vessels in the epidermis. Okay? And they are there to protect you. Here are the Merkel cells. Merkel cells are sensory. Okay? So again, here's the epidermis, here's the dermis, and then you have subcutaneous fat right here. Here's that keratin layer that we've talked about. Here are the melanocytes, but then here are the Merkel cells. They're found right here, okay, at the very deepest layer of the epidermis right here. And what they do is they sense sensation, touch. You ever have a spider crawling on you, or you feel like something's crawling on you? Merkel cells, okay? They're there to protect you. Now you're probably thinking that, oh my gosh, I got ants or something crawling on you. Well, but luckily you have Merkel cells that will help you with that. Again, these are the layers. College ladies, grab some beer. College lads, grab some beer. Stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. In thick skin, remember the lucidum is found in thick skin. There are 5 layers. If it's not the palms of your hand, if it's not your palms or soles of your feet, then you only have 4 layers. So that's a great quiz question or exam question that you might want to know. So from superficial to deep, it goes stratum corneum, stratum lucidum, only present in thick skin, stratum granulosum, stratum spinosum, and stratum basale. There's the stratum corneum, there's the stratum lucidum, stratum granulosum, stratum spinosum. Looks like little spiders, right? And then you have the stratum basale, and deep to the stratum basale starts your dermis. So stratum corneum, made up of dead cells, lack nuclei and organelles. There's about 25 or 30 rows of those. They're dehydrated cells that lack organelles. They shed in sheets. They're dry, unsuitable for microorganismal growth, and water resistant. Okay, so if you ever sit in your living room and this ray of sunshine comes in and you see all these little things floating in the air, a lot of that is your dead skin cells floating in there. A lot of times we think that that's dust particles, but most of the time it's the dead skin that's floating there. Nasty, right? Stratum lucidum is a clear layer made up of dead flattened keratinocytes, usually only visible in thick skin. Your stratum granulosum is middle of the epidermis, 3 to 5 layers of keratinocytes undergoing apoptosis, which is cell death. Can see dark protein granules, which are right in here, which assemble keratin intermediate filaments into keratin. Also visible are laminar granules that fuse with plasma membrane and release lipid-rich secretions for water repellent sealant. Okay. This is why when you jump in the swimming pool or take a shower, you don't balloon up. You have these water sealant layers that protect you. The stratum spinosum is deep to the stratum granulosum, mostly composed of keratinocytes producing by stem cells. In basal layer, you have 8 to 10 rows. They appear thorn-like in histology, have coarse bundles of keratin. Thorn-like keratin insert into the desmosomes, joining cells to one another for strength and flexibility. You ever play that game, rover, send such over, when you hold somebody's hands and you want to make sure that they can't break through, right? So you want to make sure that these desmosomes are these tight junctions, so you don't want to break through there. As cells are pushed from the stratum basale, where they're formed, toward the stratum corneum, they undergo apoptosis, and they kind of get pushed out, and then if you were to rub your skin, it flakes off. Accumulate more and more, and then from stratum basale to sloughing takes about 4 to 6 weeks. Right, so every 4 to 6 weeks you get a new layer, technically, of the epidermis. Excessive shedding, we call that dandruff. Right? Remember, dandruff starts in the basale. All right. Now we move on to the next layer, which is the dermis. So we talked all about the epidermis. Now we talk about the dermis. That's deep to the epidermis. You have 2 layers. You have loose connective tissue, and you have a strong, dense, irregular connective tissue, which contains collagen and elastic fibers. It's thicker than the epidermis. Thickness changes depending on the location of the body. It's thinner in women. So unfortunately, it is thinner in women. So the dermal layer, you can see cellulite a little bit easier in women than men. So I will be honest with you, there's really no magic cream that can get rid of the cellulite because you're in the deeper layers of the epidermis. I mean, you go from the epidermis down to the dermis. So really, surgery is the really option for cellulite, no real magical cream. Because since this layer is thinner, you're able to see the subcutaneous layer, which is the fat layer, a little bit easier. Dermis is high tensile, pulling strength. Basically leather, if you know what leather is, that's dermis. So you know how thick leather is, well, that's the dermis. Okay. Cells present include fibroblasts, synthesize extracellular matrix and collagen. Synthesize means make. Macrophages, which are there for defense. Mast cells, they're there for immunity. Eosinophils, which are a white blood cell. Acetophils. Neutrophils, which are also white blood cells. When we do the blood, I'll get into a little bit more detail what neutrophils are really there for, what eosinophils do. Right now, I don't need to bombard you with more information that you need, right? So let's just stick with the skin for right now, and then when we do the blood, I will definitely tell you what eosinophils, neutrophils, and what their function is. Dermal interstitial dendritic cells, basically they're immune surveillance cells. They just make sure that everything is good and there's no foreign invaders inside. Of course, there's blood vessels and nerves present. So when you're shaving, right, there's no blood vessels in the epidermis, so you shouldn't bleed when you shave. If you're shaving and you bleed, well, you went down to the dermis. Okay. You have glands and you have hair follicles. And you have 2 layers called the papillary region and the reticular region. On the quiz, I may ask you which region are tattoos found in. So hopefully you can, as you listen to the rest of the lecture, you'll be able to figure that out. Okay, you have the papillary region, which is closest to the epidermis. It's superficial dermis, about 1/5 loose, irregular connective tissue. It has thin collagen fibers, fine elastic fibers. Dermal papillae house capillaries, corpuscles of touch, and free nerve endings. Surface area increased by small finger-like projections, taller and more numerous in sensitive skin regions. More numerous in the palmar and plantar regions, contain encapsulated touch receptors that will detect touch. As I mentioned, if you have ants crawling on you or you have spiders, you'll be able to sense those. And then dermal papillae contain capillary loops, such as blood capillaries. Again, if you look at the reticular layer, which is a deeper layer. So again, the papillary layer is superficial. Then you go into the deeper layer. That's 4/5 of the dermis. It's dense, irregular connective tissue. It has coarse elastic fibers. It has adipose cells, which are fat cells in spaces between the fibers. It has hair follicles, nerves. Your oil and sweat glands are found in the reticular layer. Now, if you have a tattoo, remember tattoos are forever. Knowledge is power. Believe in myself. Forever with us, MJ. He touched so many. That's bad. No regrets. Gosh. No spell check on this. No autocorrect on these. You only life once. So these tattoos are embedded in your dermis, meaning deeper. So they're not going to wash off. Okay, these are with you. What actually happens is this ink is injected into the dermal layer, and your immune cells actually gobble up the ink. Gobble, gobble, gobble. And they actually swallow this up, and basically they just keep it there. Some of the ink is taken into the lymphatic system and it's broken down, but a lot of it just stays in these cells, and eventually over the years it might slowly start to fade. And the reason it starts to fade is because your immune system starts breaking down that ink into smaller and smaller particles. So technically this ink is foreign in your body. Your immune system does not like it, but it encapsulates it, and this is why you get a tattoo. So it is pretty traumatic, but tattoos have been around for decades, centuries actually, and nothing wrong with them. Some people that have an immune reaction to them, that might be a concern, but they do fade because the immune system starts breaking down the ink. Okay. Now, I don't know if you've ever heard of cleavage lines, but if you look at the human body, this is the anatomical position, you have these cleavage lines here. And plastic surgeons learn these cleavage lines so that when they make incisions parallel to these cleavage lines, you have less scarring. So in plastic surgery, if you're going to get breast augmentation or a facelift, the cleavage lines, look how detailed these are, is very important. Obviously, if you have trauma, they don't care about cleavage lines. They just want to make sure that you survive. But carpal tunnel surgery, they're trying to use the cleavage line so you have minimal scarring. Well, when it comes to the knee, look at this. Most knee incisions are actually perpendicular to the cleavage line. That's why a lot of people, you see the scars on knees more so. You can't make an incision like this. Otherwise, every time you bend your knee, that incision is going to rip apart. So there are some things that we can't control. But if you get a mommy makeover or a tummy tuck, they'll try to do the cleavage lines here, and of course with facelifts, they're going to use the cleavage lines here. Now you have fingerprints. Okay, no human has the same fingerprints except for identical twins. They're epidermal ridges. They develop in the 3rd month of fetal growth. They're little lines or whorls. The epidermis projects into the dermis between the dermal layer. Increased surface area of epidermis, increasing grip by increasing friction. So really, fingerprints are there to increase the surface area. Interdigitation between dermal ridges creates a stronger bond between the epidermis and the dermis. And increased surface area increases the number of corpuscles of touch, so you get more sensitivity.